Well, a consumption of 13 billion units of antibiotics has made India the top antibiotic user in the world. This has also contributed in making it the most antibiotic resistant as well. Now, recognizing the threat, the World Health Organization is observing this week as World Antibiotic Awareness Week. Here is more.
Inappropriate drug use has created a new menace: antibiotic-resistant bacteria. India figures among the top 40 countries confronted with the risk. The resulting infections are not just difficult to treat, but expensive as well.
This is because of three very simple reasons. We have a high background level of infectious disease, which is because we have poor water and sanitation, and also vaccination is inadequate. Second is that there is easy access to antibiotics over the counter very easily. The third is actually because our populations are getting wealthier, so they're able to afford the antibiotics. Before they were not able to afford it. But the mix of these three is creating a very serious health threat for India, which has to be taken seriously right now.
India is among the top antibiotic users in the world. It consumed 13 billion standard units in 2014. China had a corresponding figure of 10 billion and the US had 7 billion. According to a survey, 76% respondents took antibiotics in the last 6 months. 90% were prescribed by a doctor or nurse. 70% think incorrectly that antibiotics can treat colds and flu. And only 50% know that they should stop taking antibiotics only when they finish the course.
There is definite misuse, irrational use of antibiotics, and that has led to this bacterial resistance. What we are facing today, multi-drug resistance, bacterial resistance, all the bacteria are resistant to most antibiotics today. Hardly any, they are sensitive to one or two. And that sensitivity is shown in the lab. But if that is not effective in clinical scenario, then we are doomed.
Experts say there is an urgent need to address the threat and reduce the excessive use of antibiotics.
Diagnostics are very important because they can tell you what infection it is and also as to what the drug sensitivity profile is. And finally, we must not forget the role of vaccines, which can prevent a lot of the infections. So rather than get an infection and then try and deal with it by using antibiotics, if there is a vaccine preventable disease, the best public health approach is to roll out the vaccination campaigns, which is what the government of India has done.
Due to easy access, an estimated 80% of all antibiotics are used outside hospitals. Even cooked meal has antibiotics, mainly due to a lack of regulations to monitor antibiotic use in food procuring animals. India, incidentally, will be among the top 3 global consumers of such livestock by 2030. This is Anshu J. Singh's report for Rajya Sabha TV.